Coke switches to cane sugar. RFK Jr. calls it a win, but is it really healthier? The battle over soda sweeteners has taken a controversial turn. Coca-Cola's shift to cane sugar has sparked fierce debate. Health and Human Services Secretary Robert F. Kennedy Jr., a vocal advocate for his Make America Healthy Again (MAHA) initiative, hailed the move as a victory for his cause. But is this a genuine health breakthrough or a strategic distraction? Let's break down the story. In late April, Kennedy declared that sugar is poison, a statement that gained traction as Steak and Shake announced it would offer Coca-Cola with real cane sugar instead of high-fructose corn syrup. The fast food chain's decision, which will roll out in the US this fall, was met with praise from Kennedy, who linked it to his broader mission of combating chronic disease and childhood illness. However, nutrition experts caution that swapping one sugar for another may not significantly improve health outcomes. Replacing one sweetener with another isn't going to have much of an effect on health, said Dariush Mozafarian, director of the Food is Medicine Institute at Tufts University. He emphasized that the real issue lies in reducing overall added sugar consumption, not just the type. Studies, including a 2022 analysis, show that both cane sugar and high-fructose corn syrup have similar impacts on weight, blood pressure, and BMI. So why is this change causing such a stir? Kennedy has long criticized high-fructose corn syrup, calling it a driver of obesity and diabetes. His criticism aligns with research showing that excessive sugar intake contributes to these conditions. Yet, some argue that the focus should be on limiting sugar consumption rather than debating its form. To actually improve health, the administration should focus on less sugar, not different sugar, said Aviva Musicus of the Center for Science in the Public Interest. The controversy deepens when considering the source of the sugar. Cane sugar, used in the Mexican version of Coke, is often linked to glyphosate, a pesticide sprayed on corn. Activist Vonnie Harry, known as the Food Babe, raised concerns about potential cancer risks associated with glyphosate. Just looking at the molecule of high-fructose corn syrup versus cane sugar is short-sighted, she argued. We need to examine the entire supply chain. Meanwhile, Coca-Cola defends its use of high-fructose corn syrup, stating it's safe and calorie equivalent to table sugar. The company's CEO, James Quincey, acknowledged the importance of offering diverse sweetening options to meet consumer preferences. But critics say this move is more about political messaging than health benefits. The debate highlights a deeper tension. Should we prioritize the type of sugar or the quantity? As the US grapples with overconsumption of added sugars, over 75% of children and nearly half of adults exceed recommended limits. What does science really say? The answer may lie in simplifying the message: less sugar, regardless of its form, is the path to better health. What's your take? Do you think the focus should be on the type of sugar or the quantity? Trump admin's Make America Healthy Again initiative. America's health policies are at a boiling point, with every decision sparking fierce debates about science, politics, and corporate influence, and you'll want to see why nutrition experts are sounding the alarm. The Trump administration's Make America Healthy Again (MAHA) initiative has become a lightning rod for controversy, with recent announcements drawing both praise and sharp criticism across multiple health sectors. Let's dive into the details. ### Coca-Cola's sweetener shift, marketing move or meaningful change? *** Wednesday, July 23, 2025 9:03 a.m. EDT***. Coca-Cola's announcement about introducing cane sugar-sweetened soda in the U.S. has been hailed by President Trump and Health Secretary Robert F. Kennedy Jr. as a MAHA victory. But here's where it gets complicated. Nutritionally, cane sugar and high-fructose corn syrup, HFCS, are metabolic twins. As Dr. Robert Lustig explains, both cause mitochondrial dysfunction and chronic metabolic disease. The only real difference is price. The switch would require massive supply chain overhauls, potentially costing the beverage industry over $1 billion and requiring increased sugar imports from countries like Brazil. While PepsiCo considers similar moves, health experts emphasize this is largely symbolic, like repainting a house while its foundation crumbles. But here's the controversy. Critics argue this distracts from simultaneous rollbacks in food safety regulations and pollution protections. Is this genuine progress or political theater? Title X funding. From contraception to conception. 12:17 p.m. EDT**. In a dramatic policy pivot, the Trump administration is redirecting Title X family planning funds, traditionally supporting birth control for low-income women, toward infertility services. A newly announced $1.5 million grant will establish an infertility training center, aligning with Maha's pro-fertility stance. Officials claim contraception access remains intact, but reproductive rights advocates warn this could severely limit birth control availability for vulnerable populations. Imagine a single mother working 2 jobs who now faces longer waits for basic reproductive care. This shift prioritizes pregnancy support over preventive family planning. And this is the part most people miss. This reframing treats infertility as a public health crisis while potentially deprioritizing proven contraceptive access. The sugar battle. Why HFCS faded. 8:01 a.m. EDT**. High fructose corn syrup, HFCS, was once in 90% of sweetened products, but its decline tells a revealing story. Born from 1960s Japanese enzyme technology, HFCS became America's dominant sweetener by the 1970s due to corn subsidies and low costs. But its real downfall? Mounting evidence linking it to fatty liver disease and inflammation. Today, it represents just 6% of U.S. corn use, a shift driven less by regulation than consumer demand for cleaner labels. For context, consider how food trends evolve. Just as trans fats were phased out after health risks emerged, HFCS is following suit through market pressure rather than government bans. Medical meals or marketing ploy. 10:25 a.m. EDT**. Health Secretary Kennedy's praise for Mom's Meals, a $7 per portion meal service for Medicare recipients, spotlights Maha's nutrition paradox. While Kennedy lauded their additive-free chicken bacon ranch pasta and French toast sticks, Associated Press testing revealed ultra-processed ingredients high in sodium and saturated fats. Nutrition expert Marion Nestle countered, these meals couldn't be recreated in any home kitchen. The company's defense? They avoid synthetic dyes and HFCS, but sidestepped questions about other additives. This exemplifies a growing tension: taxpayer-funded, medically tailored meals that may contradict the administration's own nutrition standards. Think about this. Should government-sponsored nutrition programs meet stricter nutritional benchmarks than commercial products? Candy Clash. Artificial dyes under fire. 09:52 a.m. EDT**. Texas Attorney General Ken Paxton's investigation into Mars Incorporated, maker of M&Ms and Skittles, reveals Maha's enforcement strategy. Despite Mars eliminating artificial dyes in European products since 2016, U.S. candies still contain them, a discrepancy Paxton calls consumer deception. His civil demand for internal documents challenges the different markets, different standards defense. This follows similar probes into General Mills and Kellogg's, suggesting a coordinated push against synthetic additives. Consider what this means for parents. Identical products sold globally with different ingredients based on geography. Controversy alert. Should corporations follow their safest global formulation universally, or tailor products to regional regulations? Vaccines and ACIP, science versus skepticism. 10:49 a.m. EDT**. Senator Lisa Blunt. Rochester's stark warning connects RFK Jr.'s vaccine skepticism to real-world consequences. The Advisory Committee on Immunization Practices, ACIP, a nonpartisan panel of scientists and doctors, determines vaccine recommendations that ensure accessibility and insurance coverage. But here's the critical context. ACIP's authority relies on public trust, which erodes when officials undermine vaccine science. For families preparing for school, this isn't abstract, it's verifying whether measles or whooping cough vaccines will be available and trusted in their community. Food for thought. When public figures challenge scientific consensus, does that help or hinder communities fighting preventable diseases? Soil health, the unseen foundation of MAHA. ***08:46 AM EDT****. Senator Roger Marshall's agricultural vision ties MAHA's success to an unexpected factor: dirt. His Plant Biostimulant Act, part of a 30-bill package, promotes regenerative farming to improve soil nutrients, arguing that richer soil yields healthier food. Marshall's Capitol Hill Roundtable with Secretaries Kennedy and Rollins framed this as collaborative rather than regulatory. Consider the ripple effect: healthier soil, more nutrient-dense crops, reduced inflammation, lower chronic disease rates. It's a holistic approach, but one requiring massive agricultural buy-in. Organ transplant overhaul, life and death accountability. ***07:21 AM EDT****. Perhaps the most alarming MAHA reform: HHS's organ transplant system overhaul after investigations found organs being harvested from living donors. Secretary Kennedy called these practices horrifying, pledging new accountability measures for procurement organizations. This isn't just bureaucratic restructuring, it's about ensuring families facing unimaginable decisions can trust the system won't prioritize organs over lives. Now we turn to you. Where should the line between health policy and corporate interests be drawn? Are symbolic wins like cane sugar soda enough, or should MAHA prioritize systemic reforms like pollution controls? Share your perspective below. Do these policies put families first, or distract from deeper health crises?